It's not secret that the path to accessing adequate SRHR services for adolescents is littered with obstacles, both systemic and societal. These barriers not only hinder access but also jeopardize the health and well-being of the youth, denying them their right to make informed choices about their bodies and lives. The urgency of dealing with the cause rather than the effect is also pivotal and cannot be overstated. This regional meeting represents 5 vibrant nations: Zimbabwe, Zambia, Kenya, Uganda, and Malawi, each with unique experiences and challenges, but we all collectively share the same vision: a future where every adolescent is empowered, informed, and able to access the SRH services they need without fear or barriers, ensuring they live fulfilling lives. Over the next 3 days, we will foster collaboration among key stakeholders, share best practices, and develop actionable strategies to dismantle these barriers. Our agenda is robust, exciting, and challenge-oriented. We will review previously established advocacy goals and align them with the voices of and needs of our young population.
What's recently happening, we will show a documentary. Hopefully technology will give us a challenge of voices coming from the region just before the Honorable Deputy Minister comes in. And then these voices are showing that there is a lot that needs to be done in order for us to address the laws that govern the countries. Policies are consistent. We have got WHO guidelines that show us on youth-friendly service provision. And these guidelines are very progressive. They demonstrate that services should be affordable, accessible, of quality, and appropriate for all age groups. But we know that this age group is caught in between, not a health expert per se, but we know that there are some repercussions or adverse effects that happen when you offer some commodity to certain age groups. But we are in this conversation together to try and see what can we do to curb issues that are facing adolescent girls like Fatima.
Access to comprehensive information, services, and support to make informed choices about their bodies and future. Yet many young people face significant barriers to accessing these critical services. These barriers include stigma, misinformation, lack of education, and inadequate health facilities. When young people are denied their sexual and reproductive health rights, they are at risk of unintended pregnancies, sexual transmitted infections, and mental health challenges. This impacts their lives and has far-reaching consequences for families, communities, and nations. Our call for action, therefore, is that we must step up our efforts to ensure that all young people can access the sexual and reproductive health services they need.
For the past decades, we've witnessed incredible progress in SRHR advocacy, where we have government, civil society organizations, international organizations who've come together and work together to ensuring that adolescents and young people in all their diversities have access to sexual reproductive health and rights services. However, while we celebrate all these beautiful successes, it is critical to recognize that gaps still remain, especially among vulnerable and key populations that are young people. Today, we as the young people face unique and pressing challenges when it comes to access to information and services, particularly on issues of sexual reproductive health and rights, with concerns around when we talk about issues of sexual health. We promoting and we encourage our young people to practice morality, and we encourage them to actually have sex. Such concerns have come up. This has been exacerbated by emerging trends and calamities, ranging from what we all know, the year that was 2020, COVID-19. Lest we forget the adolescents and young people in the humanitarian setting, who many a times are left behind, and there's really no representation for them. Let's also have those young people at the back of our minds.